If you're a runner, you probably know that feeling, that dull, annoying ache right around your kneecap that just won't seem to go away. We call it runner's knee, and it can seriously derail your training. So what is really going on inside your knee? And more importantly, what actually works to fix it? Well, let's get into it. On this channel, we usually explain common musculoskeletal pain conditions. Today, we're applying the same evidence-based approach to one of the most common running injuries, runner's knee. We're going to cut through all the confusing advice and really dig into what the science tells us. So to kick things off, just how common is this? Is it just you? Well, turns out it is absolutely without a doubt the #1 injury in all of running. Yep, look at that number, almost 22%. When researchers looked at tons of studies, they found that patellofemoral pain, that's the clinical name for runner's knee, accounts for more than 1 in 5 of all running injuries. It's the most common diagnosis by a long shot. Okay, so what exactly is it? Well, patellofemoral pain syndrome, or PFP for short, is really just a descriptive term. It means you have pain either around or directly behind your kneecap. It's typically not a sharp, sudden pain, but more of a general ache that really gets irritated by things that load up the front of the knee. You know, like running downhill, climbing stairs, or even just sitting for too long with your knee bent. All right, now for the million-dollar question. Why does it actually hurt? It's so easy to jump to the conclusion that something must be damaged or out of place, but the real explanation is actually way more helpful and a lot less scary. It all comes down to a simple imbalance. I want you to picture a classic balancing scale. On one side, you have load. That's everything you're asking your knee to do. Your mileage, your pace, adding in hills and speed work. It all adds up. And on the other side, you have your body's capacity to handle that load. This is things like how strong your hip and quad muscles are, how resilient your knee tissues are, and how well you're recovering with sleep. Pain is often just a signal from your body saying, hey, the load over here is a little too heavy for our current capacity on this side. And this quote from a major scientific review just nails it. Running injuries aren't usually bad luck. They happen when the load we apply outpaces our body's amazing ability to repair and adapt. The key idea here is imbalance. And that's fantastic news, because it means we can fix it. It shifts the problem from my knee is broken to how can I rebalance the scales? Okay, but what about running form? I mean, we've all heard it, right? Someone films you running and says, see, you overpronate, or you're landing way too hard. There's this massive obsession in the running world with finding the one perfect way to run to avoid injury. But is that what the science actually supports? Here are the usual suspects. Your foot rolls in too much, that's pronation. You stomp the ground, that's high impact forces. You land on your heel. Your knee caves inward. We get told these are biomechanical flaws that are the direct cause of our pain, and we spend all this time and money trying to fix them. But let's just pause for a second. Let's step back from all the noise and ask a simple but really important question. When scientists actually follow hundreds of healthy runners over many years, do these so-called flaws reliably predict who's going to get knee pain? And here's the answer, and honestly, it's such a relief. For most of these things, the evidence just isn't there. It's either weak, inconsistent across different studies, or just totally inconclusive. Now, that doesn't mean biomechanics don't matter at all, but it means there is no single bad way to run that causes injury and no single perfect form that prevents it. Humans are wonderfully variable, and we can run in lots of different ways, pain-free. So, if obsessing over every little detail of our running form isn't the answer, then what is? Where should we be putting our time and energy? Well, let's switch gears and focus on the strategies that have the strongest evidence behind them for building a robust, healthy knee. And we're not just guessing here. What we're about to talk about comes straight from the clinical practice guidelines from the Journal of Orthopedic and Sports Physical Therapy. These are based on level A evidence. Just so you know, that's the highest stamp of approval in medical research. It means these recommendations are backed by multiple high-quality studies that all point in the same direction. So here's what the experts recommend. It's a combined approach, but there's a very clear winner. Number 1, the absolute foundation, is hip and knee strengthening. We're talking about building up the capacity of your glutes and your quads with exercises like squats, lunges, and bridges. Number 2 is to consider gait retraining, making small, conscious changes to your stride, like taking quicker, lighter steps, which can help offload the knee. And number 3, they mention that for some people, simple over-the-counter orthotics can help, but mainly as a short-term solution to calm things down. And if you're a visual person, this chart says it all. Look at that. Exercise therapy isn't just one of the options, it stands head and shoulders above everything else. That is our level A intervention. It's the most powerful tool we have. It doesn't just manage the pain, it fundamentally builds a stronger, more resilient system by increasing your knee's capacity to handle load. The other things can help for sure, but strengthening is the non-negotiable cornerstone.
Okay, so let's tie this all together. Let's zoom out and think about the big picture. The goal shouldn't be to find some fragile, perfect way to run. The goal should be to build an athlete who is strong and adaptable enough to handle the real world of running.
So here's what I really want you to take away from this. First, remember, runner's knee is an overload problem, not a you are broken problem. Second, be smart about your training load. Gradual and consistent wins the race. Third, and most importantly, proactively build your capacity. Getting stronger in your hips and knees is the most proven strategy there is. And finally, please give yourself permission to stop obsessing over achieving some mythical, perfect running form.
And that really leaves us with one final thought to ponder. We pour so much time and energy and anxiety into trying to fix how we move. But what if we shifted that focus? Instead of searching for the perfect form, what if we focused on building a more resilient runner? A runner who is strong enough and capable enough to handle the beautiful, messy, imperfect reality of the sport that we love.